So let's think a little bit about some social network methods of data collection. We can think about two broad categories of data collection. Obtrusive methods, so these are methods where the researcher is present and people know that they're being studied, and unobtrusive methods where that the people being studied have no knowledge that they're being studied, and this is usually because they're being studied after the fact. Within obtrusive methods, there's a couple of categories. We can think about some survey methods and also some non-survey methods. In survey methods, there's a variety of techniques: name rosters, name generators, name interpreters, single item summary measures, position generators, and resource generators. I'm going to focus primarily on name generators. So in name generators, respondents are asked to name alters within some focal network, such as their personal network or people in the workplace. And name generators depend on the respondent's recall. Again, in the context of coronavirus, these questions would be tailored in terms of, who did they come into close physical proximity with during a certain time frame that coincides with the period of time in which they logically may have been infected with the virus. Usually in survey research, when in general for social network research, the alters are not surveyed, but as I mentioned, in contact tracing, this is very important to do. And the level of detail collected about alters varies across different studies. Sometimes additional probes are used after the initial list of names is given by a respondent. And using follow-up probes can increase the size of the ego networks that are reported. It can also help respondents to provide names of previously forgotten alters. So, for example, Devin Brewer has done a lot of interesting work on this issue, specifically on infectious disease. He studied several different things, but including things like sexually transmitted diseases, and through a variety of techniques has enabled respondents to remember people that they've interacted with that they had forgotten about originally. Now, as a sociologist, this is interesting to think about as an issue of what might be called measurement error. As a social network and social movement scholar, I look at people in social movements like the environmental movement, for example, and often try and get an estimate of the number of people that respondents know who are part of an organization or part of a movement. And for my research, if there's a certain amount of error, so for instance, people don't remember the exact number of people, or they don't remember ties to particular individuals, it doesn't really matter that much. The main thing I'm looking at is, is it the case that people who have more ties are more active in the environmental movement? And if there's a little bit of error for, either of those variables, there's still probably going to be a positive correlation, and there isn't too much of a downside to having a little bit of measurement error. But in the context of a health crisis, this is really important. You don't want to have measurement error. You don't want to have people who are infected with, the coronavirus or some other kind of infectious disease. You don't want them to get missed by the healthcare system, for example, and to continue to spread the disease to other members of the population. And so being able to very, accurately detail people's networks in this context is really quite important. But for general social network research, here are some examples of different types of name generator questions that have been used. Once an ego network is established through a name generator instrument, respondents are often asked what's referred to as name interpreter questions to collect more information about the form and content of ties. and this can allow for more sophisticated types of egocentric types of measures, though in the context of something like contact tracing, the contact tracer would usually try to directly contact the alters rather than just simply get information from the original respondent, but they might decide to do both of those things. Some other ways of collecting data for social network research include respondent contact diaries. So this is where you get people to keep a diary for a period of time, such as a month, for example, and write in their diary every time they come into contact with someone. In the context of epidemiology, we could ask respondents to do a kind of a retrospective contact diary, although this would be subject to some level of measurement error. Data is often collected in the context of ethnographic methods. So this includes, spending an extended period of time in a particular community, doing observation and doing interviews and stuff, and then constructing social network out of those field notes. And then there's some other interesting types of techniques that involve various kinds of qualitative methods, such as mixing graphs and interviewing. So, for instance, showing a graph of a person's network to an individual and getting them to talk about it, or getting them to draw the graph themselves, and then in the context of that, getting them to talk about the other members of the network. Some unobtrusive methods include things like cell phone data, social media data, email data, historical archives, and legacy or mainstream media reporting. Now, in the context of thinking about epidemiology and thinking about the coronavirus, three things here are relatively important. So first of all, a number of researchers have been using cell phone data to try and get a sense of the extent to which people, for instance, in the United States, are following social distancing protocols. And, so are they, when there's a lockdown situation or if there's social distancing protocols, researchers have been collecting GPS data and trying to model, to what extent people are in close proximity with other individuals. And they've then been using some of this data for forecasting new waves of infections. So cell phone data has been used to try and model the spread of the coronavirus. Social media data is also kind of interesting, but perhaps for other types of problems. So it's been interesting in terms of trying to get a sense of people's understanding of the problem. And one thing that's emerged is there's been various types of disinformation campaigns that have occurred in recent months, and this seems to kind of parallel some of the same sorts of disinformation campaigns that have happened in the context of politics as well, such as the 2016 U.S. election, amongst other things. I've also highlighted historical archives, and here, to a certain extent, we can think about the data that Whedon and Cornwell used in the sociological science article. What they used it was quite a clever use of data. They used university transcript data on individuals, and that allowed them to reconstruct a two-mode network of students at I think it was Cornell, and it's a two-mode network of individual students by particular classes, and so they're using archival data to reconstruct a network in that particular analysis. So there's a variety of different types of measures that can be used to calculate social network characteristics such as centrality, density, clique detection, path length, cluster analysis, and so on. Also, a variety of visualization techniques can be used, such as the creation of social network graphs, and this can be a very useful tool. Simulations can be created to model various social network processes and to explore the potential consequences of different types of interventions. So, for instance, the Nature Human Behavior article is an example of a simulation study. And finally, various kinds of interventions can be undertaken in a number of different forms. The most obvious social network intervention is using contact tracing to try to quickly identify infected individuals and potentially infected individuals and to isolate and treat them. But other sorts of interventions, such as described in both readings, can employ strategies to reorganize social interactions, reduce path length, and reduce the size of components, of network components, in order to prevent the spread of disease. So that is the end of this lecture, and good luck with the rest of the class. And feel free to send me an email if you have any questions about